Endometriosis is a chronic condition in which tissue similar to the lining inside the uterus, the endometrium, starts to grow outside the uterus. This can cause pain, irregular bleeding, and fertility problems. Symptoms of endometriosis can vary and include pelvic pain, often associated with menstrual periods, but can occur at other times. Menstrual irregularities including heavy periods, also known as menorrhagia or bleeding between periods, also known as menometrorrhagia. Pain during or after sex is common. Pain with bowel movements or urination, especially during menstrual periods. Endometriosis is often diagnosed in women seeking treatment for infertility. Other symptoms include fatigue, diarrhea, constipation, bloating, and nausea, particularly during menstrual periods. The exact cause of endometriosis is not fully understood, but several theories exist. Retrograde menstruation, where menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body. Hormones such as estrogen may transform embryonic cells into endometrial-like cell implants during puberty. After surgeries like hysterectomy or C-section, endometrial cells may attach to surgical incisions. Problems with the immune system might make the body unable to recognize endometrial-like tissue growing outside the uterus. Endometriosis often runs in families, suggesting a genetic component. Diagnosing endometriosis can be challenging and often involves a combination of the following: medical history and physical exam, including a pelvic exam. Imaging tests include ultrasound that uses sound waves to create images of the inside of the body. MRI provides detailed images of organs and tissues. Laparoscopy, which is a surgical procedure where a camera is inserted into the pelvic cavity to directly visualize endometrial implants. This is the most definitive method for diagnosing endometriosis. And biopsy, that involves taking a tissue sample during laparoscopy to confirm endometriosis. Treatment options for endometriosis aim to relieve symptoms and improve fertility. To relieve pain, non-steroidal anti-inflammatory drugs like ibuprofen or naproxen is prescribed. Hormonal therapies including birth control pills, progestins, gonadotropin-releasing hormone agonists and antagonists, and aromatase inhibitors. Conservative surgery that involves removing as much endometriosis as possible while preserving the uterus and ovaries. Hysterectomy that involves removal of the uterus, and sometimes ovaries and fallopian tubes in severe cases. In vitro fertilization may be recommended for women who have difficulty conceiving. Lifestyle modifications include regular exercise, heat therapy or using heating pads, and dietary changes. Infertility is one of the main complications of endometriosis. About 30 to 40% of women with endometriosis may face fertility issues. Persistent pain can affect quality of life. Endometriomas, which are cysts on the ovaries, can develop. Adhesions and scar tissue can cause organs to stick together, leading to pain and bowel obstructions. There is a slightly increased risk of ovarian cancer and adenocarcinoma. Chronic pain and fertility problems can lead to anxiety, depression, and other mental health challenges. There is no known way to prevent endometriosis, but certain measures might reduce the risk or delay the onset. Hormonal contraceptives such as using birth control pills, patches, or rings to reduce menstrual flow and duration. Exercise can lower estrogen levels, which may reduce the risk. Avoiding alcohol and caffeine, both can raise estrogen levels. Eating a diet rich in fruits, vegetables, and omega-3 fatty acids may help reduce inflammation. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.